thousand rainbows in my mind will keep you close to me. Oh, remember our wedding day or the temple.
Kia ora and welcome to yet another episode of Off the Beaten Track. Now, we all know how Rarotonga has so much to offer. This week we've got something extra special in store just for you.
Rarotonga Resource Management Limited is very pleased to be a partner with the Esther Foundation in Rarotonga. We commenced our partnership with them in 2007 with our three auction prizes for their charity auction night that was held in Auckland. And the packages that were auctioned that evening raised, like a tremendous amount of money for Esther Foundation's programs here on Rarotonga and the Outer Islands. And again, we were so pleased with the outcome, of those results, and we were honoured to be invited back again to sponsor 2008 prizes. And again, we're very pleased to be able to support Esther Foundation's programs into the future.
We attended the Esther Foundation charity auction in 2008 in Auckland, and we were fortunate enough to get a package deal from the Rarotongan Resorts, and we're here and we've brought friends with us, and we came last year as well, visiting the Esther Foundation, seeing firsthand the good work that they're doing and the improvements. Also too with Karen, she's upped the profile of Esther and brought it to New Zealand, and also with the work that she's doing here with her volunteers, with the volunteers. Being involved with the Esther Foundation and the committee in New Zealand, it's given us opportunities. Both 2007 and 2008 we were fortunate enough to bid for package deals from the Rarotonga Resorts, and we've come with friends this year. We've bought them and we're staying at the lovely Manuia Beach Resort and having a wonderful time. We love Rarotonga, the people. It's good to see what's happening in the various villages, etc. And yeah, it's just a beautiful place. I had never heard of the Esther Foundation, and we became aware of it, and then we decided that we would support the group, and especially with the auction that was coming up in October, and that was 2007. And so we all got together. A lot of the members of the family were involved, and the venue, everything, and it surprised us, the money that was raised. I think it was in excess of 20,000.
Many of you who had visited Rarotonga 10 years ago, you might have had slight accidents along the road. Many of you or your friends might have hit into stray dogs, stray animals running across the roads in Rarotonga. If you come to Rarotonga today or into the future, you will not have those problems ever again, because you've got the Esther Foundation people there in all their vets actually controlling the animal problem on Raro, and they've actually helped to make Rarotonga a much more pleasant and safer place to visit. The Rarotonga Resorts Management strongly supports all the work that's been done and carried out by Karen Galvin at the Esther Foundation, and I stand here together with all our colleagues in the Cook Islands tourism industry to congratulate Esther Foundations for their fantastic work in the Cook Islands.
Rohan's looked after us so well here, and we've thoroughly enjoyed it, and it's just super to see you again, so yeah.
Oh, good to have you again, Raro.
Yeah, so he's had a pre-med.
Apparently.
Hi, my name's Jenny. I'm originally from London. I've been living in Sydney since last December, and heard about Esther Honey through some friends that I met in Australia, and I thought, seeing as I'm so close, I'll just come over and help out and see the kind of work that you're doing. I've been here a day now, and everything's going really well. Today we've got some neuterings on, 2 little boys that need castration. Obviously that's the main focus of our work here, concentrating on keeping the island's population of domestic animals down. Obviously, not only does it prevent unwanted pregnancies, but obviously the health concerns as well. Obviously they get sexually transmitted diseases too, and the more unwanted animals and feral animals we have, the more disease is going to be passed on to our domestic pets. So the most important thing you can do really is to bring them in and get them desexed as soon as you can. We usually recommend between 5 and 6 months, but there is a possibility of doing them earlier, just before they reach their puberty age. Desexing male dogs and cats is, I know people are concerned about doing so. In fact, what you don't realise is that if you desex them before they reach their age of puberty, they actually don't get the hormones that cause all these unwanted behaviours. So if you get your dog castrated or your cat castrated before 6 months old, it hasn't had that rush of hormones, which has made it inclined to go wandering after females, so therefore less road traffic accidents. Their behaviour is better, they focus on you better, and also they have just less urination, unwanted behaviours in that respect as well, and just generally more well behaved. And the barking doesn't really start until after puberty as well, unless they've caught it off another dog, in which case it's learned rather than a behaviour. But definitely by 6 months get your dog neutered. Okay, so he's a little boy, so we're going to castrate him. Little boys are the easiest surgeries to do. We don't actually put them on the anaesthetic machine, we just give them an injectable form of anaesthesia. It's not as safe as having them on a circuit, but you use them for a longer surgery. Whereas if you're doing a short procedure like this, and we monitor them throughout, we also have the ability to actually reverse what we've given them. So if we're worried about their blood pressure or their heart rate, we just give them another injection and it wakes them up. So we're just watching him now. Surgery, 5 minutes. Yeah. Recovery, well, we're going to give another drug in a minute, and we have to wait half an hour just while that drug wears off. So recovery will be in about half an hour. And once we've given all the reversals and everything, he'll just wake up. But he'll just be a little bit sleepy because one of them cannot be reversed, and lasts for a couple more hours. But actually that's good because it's a pain relief injection as well. So he should be pretty comfortable. Quite often I'll give them a non-steroidal anti-inflammatory injection as well, just to stop any inflammation. Little boys, you just make a tiny incision so they're left open to drain. You don't even have to suture up the wounds. So it's pretty good. I'll just check his heart.
So let's introduce you to Kia, a beautiful Rarotongan mama dog. Kia is a good news story for us here at Esther Honey because Kia and her 9 gorgeous 3-week-old puppies were discovered by our volunteers when they were out conducting the 2009 census in Area 13. So here we have this gorgeous mama dog and her 9 puppies. Kia's owners, through consultation and discussion with our volunteers, brought Kia to us. When our volunteers discovered Kia and her puppies, they talked to Kia's owners and spoke to them about the benefits of making sure that the puppies were defleed and dewormed, and also the mama was defleed and dewormed. So essentially these 3-week-old puppies are going to be ready to be rehomed in about 3 weeks' time. But what it means when puppies come into Esther Honey like this is that we can care for them and the mama, we can give them a safe environment, and we can make sure that they are very healthy. We can also ensure that they are adopted out to good families and that they are desexed at 3 months of age. So when somebody comes in to adopt a dog here at Esther Honey, we take great care to make sure that the dog is going into the right sort of environment, and that they're going to have as good life as possible, because once they leave our care, then they are in, their life is in the hands of their new guardians, and we want the best for these dogs. So Kia will be desexed once the puppies have all left her, and she will not have to endure having another set of puppies. As beautiful as they are, and as tempting as it is to keep breeding dogs, 1 litter per year can create hundreds of puppies over just a few short years. So here we are with Judy Ford and her new dog Magic. Magic was an Esther honey orphan, and one day we received an email from a lady in New Zealand who was looking for a Labrador-like dog for her parents. And funnily enough, the day before we received the email, Magic actually was handed over to us as a homeless dog. So little did we know that the girl that sent the email from New Zealand was actually Judy's daughter, Judy and Barry Ford's daughter. And Judy and Barry had a beloved Labrador dog who had passed away recently, so they didn't have a special dog, and Judy and Barry's daughter were looking for a new friend for Judy and Barry, and a dog that could be a resort dog. So to cut a long story short, this dog, who is Esther honey named Lala, now resides here with Judy and Barry at Magic Reef. She's a resort dog and she's named Magic. It's a really beautiful story, and we're grateful that Judy and Barry have given Magic this wonderful opportunity to a great life. You'll see Magic driving around in the Magic Reef Bungalows van. She takes pride of place in the front, and I think that the guests really love her. She's a beautiful, beautiful girl. So it makes me really happy when I come here and see Magic enjoying her life with Judy and Barry and all the guests that come here to Magic Reef. Hey Magic!
Hello, this is Oscar. He's an 8-week-old male puppy, and we rescued him from Mangaya. Okay, so the reason that we brought Oscar back from Mangaya was because he was found abandoned behind a shed, and when we examined him a little bit closer, we realised that he had health issues, and we thought it'd be best for us to bring him back here to work out what was wrong with him. Oscar is a special puppy because he has a few problems. When he gets to water, he just drinks and drinks and drinks, and he blows up, you can probably see, and then we have to stop him drinking water, otherwise he would just carry on and on and on. Dogs can, for some reason, we don't really know why, get a psychological component where they just want to drink water. There's not really much you can do about it except restrict the water from him. Oscar is up for adoption, but he'll obviously need someone who can look after him really well and care for his special needs. There is a drug that we can try and get from abroad which might help his condition and make him not want to drink so much.
And we're here in the Esther Honey X-ray room, and I just wanted to tell you a little bit about this room and what we're able to do now. We have this new X-ray machine. It's only a few weeks old. We haven't had it very long. Got here a few weeks before I did. And it's been really great because it's allowed us to diagnose a lot of problems in the animals that have come in here that we probably wouldn't be able to find out without this machine. So basically we set up this machine, we put the animal down on the table here, put a film down, and take a picture, and it allows us to find out if animals have broken bones, if they have any internal injuries, if they have any masses or like any cancers, any problems with their teeth, all kinds of things that we can find out from this X-ray capability that we have here. So just to show an example of what we do here, here's an X-ray. This is a dog's leg, and if you can see right here, these are actually the bones of the leg, and right here we see that this bone right here is broken. It should really look like this, one long piece, but instead there are two pieces right there. So that's something that we could probably feel, on the dog if we didn't have this machine, but we wouldn't really know where the break was. We wouldn't know the exact details of the problem that the dog has. So this is great because we can see this, and then we can actually do something very specific to fix the problem. So this is an X-ray of another animal. This is the chest right here, and then this is the stomach area, and the head is up there. So we're looking at the heart right there. These are the lungs. These are the ribs. And this animal actually has some broken ribs, which you can see right there. And the heart is also not a very normal shape, so might have some sort of heart problem. So again, this is telling us a lot of good information about this case and helping us diagnose the problems that the animal might have.
So here we have Roxy and Snoopy, our mama dog and its puppy, who were brought in yesterday with fish poisoning. Obviously, they have both eaten the same fish and are not doing so well. The mama in particular is pretty bad. And we have vets, Natasha and Laura from the UK, who are treating them.
Okay, so this is Snoopy and this is her baby Roxy. They both came in yesterday. Their owner thinks they might have eaten something. We're suspecting fish poisoning. Both of them were really flat, not really able to walk. As you can see, mama dog's still not doing very well. But Roxy seems to have picked up overnight on fluids, so she's doing better out of the two of them. So basically we're just continuing intensive care treatment for them and hoping for a full recovery for both of them. So when we get a fish poisoning case, we have a protocol which we follow. Depending on how long it's been since they've ingested the poison, there's certain things we can do. We can make them sick to try and get rid of the toxin. Unfortunately, both of these were reported to start having symptoms at the weekend, so it's a bit late to make them sick. The other thing we can do is give them activated charcoal, which absorbs the toxin in their stomach, but again, with these two, it's a bit too late. So the only thing we can do is put them on fluids, try and reduce any of the signs, because they often present with nervous system signs. And then basically nutrition is really important, so we have to hand feed them, syringe feed them 5 times a day to try and get them, to try and help them recover as well. So it's quite hard intensive care.
She's been with us for just over a week now and is making quite good improvements. When she first came in, she was just lying and she was often seizuring. She had quite a lot of treatment, both day and night. Kept us awake several nights with her crying throughout the night. But she's now got back the use of her front legs, and we're trying to work on physiotherapy to get her to use her hind legs as well. So obviously fish poisoning is a real big concern for us, because these dogs can be quite sick and they're difficult to look after, and we don't always manage to succeed. So although humans are also susceptible to it, we know that they don't suffer as badly. So feeding table scraps and fish to the animals, they can get it just from that. So it's important to be careful what you're feeding the dogs.
So my duties here as a vet, I'm here most days treating animals, doing surgeries, but about once a week I'll go out on a 2009 census, which is a project that Esther Honey is doing right now, to basically do a survey of the number of dogs on the island, dogs that are desexed, dogs that are registered, basically trying to find out more about the population of animals on the island. Well, actually, my perception's been very positive so far. I've been trying to go not only to houses along Main Road, but houses as far inland as possible to walk in, and also looking at any strays that I might see. And just talking to people, I was really, really pleased to see that most of the animals that I've come across are desexed, are registered, and only a few here and there, aren't registered. In those cases, we'll leave a notice for the families, encouraging them to bring the animals in. So I think Esther Honey is apparently doing a very good job at educating the public and getting owners to desex their animals to be responsible pet owners. So I've been very pleased with the situation. So basically a notice of the census, basically explaining what we're doing, and explaining that pet owners can basically call us, make an appointment. It's free of charge, although we accept donations. You just make an appointment, bring in your animal, and it's just, they come in the morning, and in most cases we'll be ready to leave in the afternoon. So it's a quick procedure, and we just want to encourage people to do that for their animals. This is our map here. It's divided into basically sections 1 to 34 all the way around the island. The area that I've been focusing on is the Murray Beach area, so if you live around there, you've probably seen me and another vet walking around just going up to houses and talking to people. So, so basically, you know, one or two of us will go out each day and address a different area of the map. We basically pretty much completed the Murray area and some areas close to where we are over here. Near the clinic, and we're just trying to work our way around basically and get as much information as we can about the animals.
My name's Laura. I'm from Sheffield in England and I'm a recently qualified vet. I've just come out here to volunteer for 9 weeks. I'm into my 4th week now and really enjoying it. Got little terrors like this to play with all the time, haven't we? Bambi, as we've named her, she was brought in from census. She had a fracture of her hind leg, and actually when we picked her up was so scared that she like squealed if you went anywhere near her. Fortunately we had a senior vet here at the time and he's managed to pin it, and as you can see now she's doing really well and she's got really friendly. And the pin comes out next week, so she's doing amazing. So basically this is the leg that she broke. If you can see properly, but this is like her scar where we had to make the incision, and the pin is basically running in her femur and it's kind of poking out in her hip, and basically we just make an incision over that and pull the pin out, and hopefully the bone, we'll take an x-ray beforehand just to check that everything's healed, but it should all be in place and she's good to go. Bambi's looking for a new home. She's probably about 4 months old. She's a really playful puppy, loves attention, you know, loves cuddles, as you can see. She basically, because of the pin in her leg, when she goes home and the pin's out, it's not going to restrict her. She can live a normal life as a normal dog would. She doesn't need, you know, high maintenance care, just a bit of love and attention really, and you know, she loves the beach, so the odd walk down the beach. I think she'd make a great pet. Yes, I came out here with Natasha, who I train with at university, but also there's a few girls here who are also in my year, but I didn't actually know, but we've managed to like develop a really good relationship. And also there's a really nice nurse here at the moment, and we just bonded really well. And yeah, we go out on Friday nights together, group of English girls. I don't really know what the locals think of us, but we seem to have a great time.
I'm also a musician as well as a veterinarian, and fortunately since I've come to Rarotonga, I've had the opportunity to play at several places on the island, a few restaurants like Waterline and Salsa, and I've done some shows with Talk at Aquarius and done some open mics, and I've just had a really, really good time, and hopefully we'll be able to keep playing around town during my next week here. And I encourage all you guys to come out and check out the local music scene because it's really, really great here. I think it's something new because I play a lot of Brazilian music and some jazz and originals too, but I think it's fun because it brings another sort of cultural aspect to the community. I do write my own music, and it's sort of a, I guess, kind of folk jazz, Latin sort of fusion, but I really, really like world music of all sorts, and I'm definitely going to pick up a bunch of CDs before I leave and, you know, just try to absorb as much of this musical culture as I can and definitely incorporate that too.
Well, I hope you enjoyed that as much as I enjoyed making it. Stay tuned, same time, same place next week. Till then, ka kite.
Oh, hi. My name's Lucky. I live here at Esther Honey, and I like it a lot. The volunteers are really nice to me. I get really cool clothes to wear, and I get lots of nice food and stuff. Okay, yeah. Bye.